You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, public health advocate Dr. Tony Leachon. Dr. Tony, first off, I wanted to ask you already, good morning to you, your reaction on General Cascolan's appointment as DOH undersecretary.
Well, for a moment, I was surprised, but after reflecting on it, several military officers, senior officers, were also appointed to key health positions in the past. Andyan sa Baksinzar, former Chief of Staff, my boss, my previous boss, Secretary Charlie Galvez, if you remember. And then, of course, sa PhilHealth, we have General Ricardo Morales, no? Again, a military officer. And I think for a time, though hindi military officer, but along that line of investigation, NBI Director, Attorney Dante Gueran, also nag-work din sa PhilHealth. So, hindi bago sa akin itong appointment eh. And that's the Peter Principle eh. Sa hierarchy ng promotion, yung senior officer, once they reach their highest post, binibigyan sila beyond the level of their competence eh. And sometimes hindi siya nalalagay doon sa dapat kalagyan, yung right man for the right job, for the right time and the right place. And in our country kasi, that's the presidential prerogative to choose their cabinet members and even public officials based on loyalty, trust, confidence, and of course politics.
Pero I know that you mentioned other agencies, no? But in the DOH itself, meron na ho bang military man, police general na nagkaroon ng USEC position sa Department of Health?
I think this is the first time to have a military officer or a PNP, former PNP chief at the Department of Health.
Okay.
So we don't know yet the official designation that will be aligned with the skill set of former PNP Chief Camilo Cascolan.
And because we don't know yet, and once we find out, at this point, do you think there could be some complementary position on his experience in a particular USEC job under the DOH?
Well, to be fair with him, I worked with him sa National Task Force, no, sa Zoom meetings during the pandemic. I was there in the first 3 or 4 months, and I found him assertive, organized, and up-to-date sa report during that time. So I cannot judge him. But I know he has a master's also in public administration. So I don't know whether he would be assigned, let's say, for regulation, procurement, deployment. No, so I don't know. Okay. Kaya mahirap. Meron lang ang mga tao na preconceived bias dahil Department of Health, MD position ka. And of course, lagi kino-consider yan. Kasi if you're an MD, then you can add a lot to the plate considering we have a huge problem right now. May COVID pandemic pa, may SONA goals ka pa, aggressive one, and then of course you have the implementation of universal health care.
Okay. Doc Tony, we just need to take another short break. We will be right back.
Regent Mochi, your locally produced glutinous rice cake, comes in mango, green tea, ube, and assorted flavored packs. Regent Mochi Japanese-style glutinous rice cake by Regent.
I'm Susan Audrey Rivera. I'm the Consumer Banking Credit Head, and we've been working with TransUnion for 10 years already.
I'm Jin Bigo, and I head the consumer bank for the Bank of the Philippine Islands. I've been a director of TransUnion since 2012.
Trust is first and foremost, actually. That's how we got into this partnership in the first place. As a credit bureau, we are given access to data from the outside, wherein we can do a lot of insights on the customer behavior, particularly in handling their credits and their loans with different institutions.
Well, you know, we're a bank, and trust is important. And trust is hinged on our ability to really understand our clients and make access of credit to more Filipinos available.
TransUnion is a global information and insights company that makes trust possible in the modern economy. We help uncover unique stories, trends, and insights behind each data point. This allows for businesses to better manage risk and consumers to better manage their credit and personal information and identity. Through the power of information, TransUnion is working to build stronger economies and safer communities worldwide.
The credit tools developed by TU is now a critical component in our digital onboarding process that allows us to serve a wider market.
We've been able to really learn a lot from the data that we have managed to accumulate over the past 10 years. We've been able to see a more holistic picture of the customer.
TransUnion's mission is to serve as a catalyst for nation building by promoting financial inclusion, ultimately saying yes to more Filipinos and increasing access to credit and other services. This is what we call information for good.
You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, our source, public health advocate Dr. Tony Leachon. Dr. Leachon, let's talk about the XBB and XBC variants. So we have recorded cases of about 81 of the XBB and almost 200 of the XBC. Are these, would you say, the most transmissible variant?
At the moment, siya ang most transmissible, more transmissible than the BA.5. It is these two subvariants are considered immunoevasive. Ang ibig sabihin, even bakunahan na tayo, the booster pa, pwede pa rin tayong mahawa. But the symptoms, wala pang pinapakitang serious or magiging critical. Ang description lang is highly transmissible, immunoevasive, and then ang pinakahuli, ang sinasabi nila, this may actually dodge yung usual vaccines natin. That's the need for the new bivalent vaccines, na new generation vaccines.
So you said eventually dodge. So that leads me to ask, how effective are the vaccines we have at the moment, especially for those who have gotten boosted against these XBB and XBC variants?
Well, we need to upgrade ourselves pa rin. Like for example, in my case, I had two primary and two boosters pa rin. Eventually, kailangan din natin ng fifth booster para dun sa new variants kasi that will protect us yung dati from the previous variant, yung mga B series. But for the XBB and the XBC, ito yung dapat nating kunin. And I think we have talks right now with Moderna and Singapore. As of the latest, mag-i-start sila na up to the last quarter hanggang December because right now 55% of their cases of XBB in Singapore meron sila ngayon. So dapat ganun din ang strategy natin considering yung areas natin in the countryside kung saan daw tinamaan ang maraming mababa ang vaccination, yun ang meron. So kailangan masupplyan na natin sila through adequate deployment of these particular bivalent vaccines.
Kailangan we should be able to purchase these. Basically, you're saying, Doc Tony, as soon as possible.
Right. And then merong confirmation coming from the Moderna distributor that by November magkakaroon tayo. We hope na involve kaagad ang private sector dito so that we can immediately deploy this because this will need also cold chain facilities and immediate deployment and distribution. And of course, a lot of logistics issues here. And sama na rin natin ang mga huge pharmacy chains and hospitals at the medical community so that we can move more expeditiously considering ang nangyari sa atin sa initial booster program natin, naka-bottleneck lang sa government. I think we need to move in different express lanes right now.
Dr. Tony Leachon, sir, thank you so much for your time.
Thank you very much, Pinky, and it's a pleasure.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.